Here is a summary of some key points that one should be aware of concerning the coronavirus and how to best protect oneself from the infection. Viruses are actually not life forms in the sense that life forms are understood, but are infectious acellular organic structures that exist everywhere. They are lifeless structures consisting of one or several molecules, which in certain ones of the approximately 2.7 million species and various forms, such as sphere, rod, or tail carrier, and so forth, are surrounded by a protein shell, but are also carriers of DNA or RNA, and thus of the information of the genetic material for their proliferation. If viruses do not find any host cells in their environment wherever they exist, or in any life form, then they paralyzingly deteriorate and dissolve in their organic structure, because they cannot die away or die because they are effectively lifeless and are not life forms. Due to the fact that this is a very highly contagious virus, one should avoid airplanes, ships, mass transportation, and large crowds, family gatherings, parties, unnecessary traveling for holidays, etc. And whenever possible, it is best to stay at home rather than to expose oneself to the risk of infection or to infect others if one is already infected. Contrary to the data by the WHO, the incubation period is not 2 weeks, but is between 2 to 4 weeks, or in some cases even up to 3 months. However, it is also possible that the incubation period ranges from some hours up to some years, which in each case depends on the form and the state of the immune system. A spread of the coronavirus can already occur after some seconds, that is to say, after the moment of the infection, therefore not only when it becomes detectable and acute. There is a constant danger of being infected with the coronavirus by persons who are infected but do not show any symptoms. Consequently, they also have no inkling at all that they themselves are the carriers of the virus and therefore, unsuspecting, infect their fellow human beings and can therefore pass the coronavirus on unnoticed. An infectious contact can occur through being too close to an infected person's normal exhalation, coughing, and sneezing, or through infected cats and dogs, because also pets can be carriers of the coronavirus. Indirect ways of contracting the coronavirus can be from items, body surfaces, or food on which the infectious airborne droplets have settled, provided that the virus subsequently gets into the body via the mucous membranes, for example the mouth, the nose, or eyes. A transmission via the fecal-oral way and other body excretions is also possible. There is also the possibility of a transmission via infected animals, creatures, and house beetles, such as cockroaches and so forth. The virus can persist for a long time in wastewater and ventilation systems and call forth terribleness, as well as can establish itself on certain open food, that is to say, cut food, especially on meat, and have an infectious effect. In contrast to other viruses, the survival time of the coronavirus is very, very high. Outside of the human body, it can remain active not only for a few hours, as is the case with other viruses, but it is able to survive up to 3 days and even up to 96 hours, depending on the material and surface of the objects and the environment, weather, and temperature, before it becomes weak, loses its activity, and becomes ineffective. If clothes are contaminated, it is not enough to hang them in the fresh air overnight, because the virus remains active for a long time. Therefore, the clothes must be washed at 60 degrees Celsius so that the virus is safely destroyed. One must pay attention to maintain a social distance of at least 2 meters or 6.5 feet from other persons. This is due to the fact that while breathing and speaking, breath wisps are emitted and also exhalation droplets are propelled, which float through the air and are inhaled by persons that stand too close, leading to a possible infection. This distance only applies in wind-protected rooms and locations. However, where there is a wind, depending on its strength, correspondingly wider spaces must be considered, and also the wind direction, because the expiration droplets, that is to say, the aerosols, can be carried up to 10 or 15 or more meters, or 30 to 50 feet or more, and therefore can also be breathed in at quite a distance by other persons, who then become infected. If communications are carried out with people who have a cough, who sneeze, or who emit spitting moisture when speaking, then a safety distance of 3 meters or 10 feet or more must be maintained. Of course, it is sensible not to shake hands with anyone. However, if touching another human being cannot be avoided, or if, for example, doorknobs or railings, etc., in public places must be touched, it is important to disinfect one's hands regularly with 70% alcohol or with a suitable natural soap. Instead of using public transport, it is advisable, wherever possible, to drive with one's own car and also to regularly wipe its door handles and steering wheel, for example. Normal, commercially available protective masks or self-made protective masks of all types can be useful against the expulsion of breath and expiratory droplets and against a moist speech. However, these masks can only prevent expiratory droplets from escaping, or they slow them down considerably. Nevertheless, tiny germs such as viruses, bacteria, and microorganisms can emerge unhindered from these masks, and due to their tiny size can easily be carried up to 1.5 to 2 meters or 5 to 6.5 feet away in the air by the slightest breeze. Consequently, persons who are present can be infected by them. Protective masks must be professionally and specifically made from suitable non-woven filter material which does not allow the breath and expiratory droplets to either escape or enter. Masks made of paper and of simple filterless materials, which also include self-made protective masks of all kinds and materials, such as handkerchiefs, scarves, microfiber cloths or cleaning wipes, cuddle cloths, bibs, napkins, as well as headscarves, underclothes, face towels, balaclavas and neckerchiefs and so forth, are absolutely unsuitable and useless. Products of this kind are in no form suitable for protection. Rather, they lull the wearers of such products into a false sense of security. This applies equally to cheap or rejected industrially produced masks as well as to visors. Transparent face shields, so-called visors, are not only useless but also misleading regarding safety and are thus dangerous to health. Such visors are open at the bottom and on the sides and therefore do not hug the face but only the forehead and therefore do not seal. As a result, both the breath and the expiratory droplets are expelled from the mouth uninhibitedly and spread all around. This also happens from elsewhere, that is to say, from other human beings, whose breath and expiratory droplets can penetrate under the visor, which can then cause an infection in the person who inhales these particles. Goggles which conceal the skin all around are absolutely necessary to protect against an infection by bacteria or viruses, and in the case of the coronavirus, the tear fluid of the eyes provides a favorable environment for the pathogen to establish itself. Fundamentally, good and correct face masks are only useful when used in conjunction with suitable protective glasses. Protective masks are only useful if they fit the face properly, provide a good seal, and completely cover both the mouth and the nose. A sufficient great distance between human beings is always the best protection to avoid being infected. But unfortunately for many people wearing protective masks, this means that they become reckless and indifferent, no longer strictly adhere to the necessary precautionary measures, and therefore become infected with the pathogen despite wearing a mask. Only professional FFP2, in North America the N95 or in China the KN95, non-woven protective masks and effective FFP3 or the P100 filter protective masks, which are effectively purposive and contain appropriate filter materials, can be worth recommending. In which case the FFP3 filter protective masks quite especially and solely are suitable for protection against viruses, bacteria, and microorganisms to a high percentage of over 90 to 96%. If necessary, one can lightly spray these masks from time to time with 70% alcohol as a disinfectant. Good and tested FFP2 protective masks are an innovative filter medium which offers a certain protection and safety against material foreign substances as well as against aerosols and expiratory droplets, fungal spores, microorganisms, bacteria, and parasites, but is not suitable against viruses and is designed only for low breathing resistance. If wearing of protective masks of the FFP2 or FFP3 quality and keeping a distance of 2 meters or 6.5 feet is maintained, then, as a rule, one is sufficiently protected. However, protection can only be guaranteed by that if a purposive and face-sealing protection mask is used, which is worn correctly and thus also adapted to the shape of the face, and the correct donning and doffing and so forth is observed, which is absolutely unsuitable for bearded persons of all kinds, including 3-day beards, because with a beard, gaps are unavoidable with masks which must fit tightly. Without exception, a strict hand hygiene is always necessary in regard to hand washing, because very often it is via these that contagious infectious diseases are transmitted to other persons. Therefore, regular and thorough hand washing with soap and water is of ongoing urgency in order to render pathogens harmless. Hand disinfection can also be achieved using 70% alcohol. However, one should never use chemical disinfection agents. Chemical hand cleaners and chemical hand disinfectants should not be used because they are health damaging for the skin and also penetrate through the pores of one's hands into the organism. If the hands are repeatedly disinfected with such toxic agents several times a day, severe disinfectant poisoning is the result, whereby the entire organism is negatively affected. In addition to severe organic ailments and illnesses, also unpleasant and even dangerous dizziness, unsteady gait, and disorders with regard to thought, feelings, and the psyche can arise, but also nausea, visual impairments, neurological disorders, and behavioral disorders, and so forth, which may remain for life. If a contact with an infected person has occurred, then a corona test should immediately be done, and one should voluntarily isolate oneself from other human beings for at least 30 days, because the incubation time can last longer under some circumstances than is generally assumed by the experts. As a result, tests should be done after 14 days and after 1 month. At the beginning of the infection, the virus multiplies in the oral pharynx and nasopharynx, and when a swab of it is made and is investigated in the laboratory by searching for and finding the genetic material of the virus in the specimen, then a sure result is produced, because such a test, as a rule, shows a high degree of accuracy in regard to the new coronavirus. Also, antibody tests are necessary in order to be able to prove whether a human being had already been infected by the rampantly spreading corona disease or not, as well as whether he/she has developed a certain immunity against the virus or not, although this can, however, be just short-term, but also long-term, depending on the case, whereby one cannot expect any so-called herd immunity. Also, evidence of antibodies does not mean a final healing or immunity, because the antibodies of this virus can quickly diminish again, become weaker, and under some circumstances completely dissolve again. Coronavirus gene alterations, which have arisen and continue to arise through mutations, can form new genetic variations, which lead to different symptoms, which can also be wrongly assessed and wrongly treated by medical practitioners. Children, for example, whereby it especially affects the younger ones, are infected by one of the diverse mutations of the coronavirus, which especially takes effect with heart and lung inflammation. The mutating and genetically ever-changing coronavirus does not correspond to one that specifically targets a particular age group with human beings, but one that spreads to all human beings of all ages, therefore also in unborn babies, toddlers, older children, adolescents, and adults of all ages, including the oldest human beings. It attacks all their organs. The dangerousness and lethality of this insidious, rapidly spreading corona disease is due to a continuous mutation of the virus, in which case the mutation changes which arise from it bring about newly occurring genetic variations that become more dangerous and aggressive. The new corona mutations have the property of infecting a human being not only with one mutation alone, but that one can be infected by two or possibly even three of them, and also that a human being infected by one mutation and cured can be infected again by another corona mutation and fall ill. Finally, in conclusion, do not allow yourselves to be misled into wrong, inadequate behavior measures by inconsiderate, negligent, and reckless orders of a kind which are official and governmental or organizational based, as well as private. Seductions in relation to wrong modes of behavior of any kind can lead to dangerous health consequences, and in this respect it can be that halfway effective safety measures are relaxed and repealed too early. A protective distance of 2 meters or 6.5 feet from other human beings should be absolutely maintained, such as while walking on paths, roads, squares, and other places, as well as when using public transportation and so forth. In which case, the wearing of a suitable protective mask, either a FFP2 or the N95 or the FFP3 or the P100, as required, should be mandatory. The wearing of masks of this type for protection against infection is fundamentally sensible, which is why directives and regulations in this regard ought to be followed, because as with any other rampantly spreading disease, also the corona disease is a very life-threatening and serious matter which must not be underestimated. This is contrary to the simple-minded claims of liars and conspiracy theorists that claim that the corona disease does not exist or that lockdowns are a form of governmental control over their basic rights. Additionally, there are many people who are of a low intelligence and are simple-minded and who demonstrate against the wearing of masks, the keeping of a safe distance, and the ban on going out and so forth in a riotous and destructive form. Even after the peak has been reached, the danger of the rampantly spreading corona disease will not be averted, because even after the disease has subsided, it will remain active and in the course of time will claim many more infections and deaths. Consequently, all necessary precautionary, preventive, and protective measures should continue to be heeded.